I'm sure your busy schedule is just the start of the week, and you allotted your evening, your first evening for the week, to join us in this exciting, interesting conversation. I'm Dr. Renzo Guinto. I am a physician, alumnus of the UP College of Medicine, class of 2012. But I am not a physician who is looking at individual patients. I always say society is my patient and the world is my clinic. So that's why I'm, addressing like the broader social and environmental determinants of health. Right now, I'm working for an NGO called Healthcare Without Harm. That NGO focuses on transforming the health sector so that healthcare does not do any further harm, being true to the Hippocratic Code. No further harm on both planet and people. I also am the co-founder of Reimagine Global Health, which is the one organizing this event. It's a new group, it's an exciting group, and all of you are invited to join us. We want to develop a new cadre of Filipino, of Asian, of global health professionals, not necessarily just from the health sector, but from other disciplines who have deep concern for global health, who wants to make this world a healthier, a more environment-friendly, and a more just society. So that's basically our work, and that's why we are here to have these this kind of really world-changing conversations. And for today, our topic is on sexual and reproductive health rights, or SRHR. So I'm still trying to get used to the acronym. It's a global conversation that we're having tonight. Thank you for coming again. Please don't forget to sign in the attendance sheet that we're circulating at the moment. And we're also recording this conversation because a lot of our friends from around the world were asking, is your event going to be live streamed, web streamed? And we don't have that facility at the moment, so we're going to upload this in YouTube. But certainly in our future sessions for Reimagine Global Health series, we will be using those technologies to bring the global conversations in the Philippines to the world. So today we are blessed to have an amazing group of young sexual and reproductive health rights advocates from not just one country, but from 5 countries, from all continents of the world. So it's really a global conversation that we're having today. They are members of the Youth Coalition for Sexual and Reproductive Health Rights, also known as, in short, Youth Coalition. So visit them in their website, like them in Facebook, follow them in Twitter. But I will ask them to just briefly introduce themselves, your name, your country, and your role in the coalition before we proceed to the actual discussion. So let's start with Cuba.
Yes. So hello everyone, thanks for coming, and we hope to keep up to meet your expectations of the event. So my name is Cuba, just like the country is to remember. I'm from Poland, which is Central Europe. So we are all here from Youth Coalition for Sexual and Reproductive Rights. I'm currently on the board of directors and I deal with money, so I'm the treasurer in the organization. So I studied political sciences, and that's my background.
Great. Maybe later. Okay. In your personal stories.
My name is Daniel. I'm a physician as well, like Renzo. I'm from Colombia, South America. I worked in the IFMSA when I was a student. So when I came out, I joined the Youth Coalition, and I'm now in the board of directors. I'm the person in charge I'm the staff liaison, so I deal with all the staff issues, and I also work in the Sexual and Reproductive Rights and Development, HIV working group.
Great. we'll be hearing a lot of acronyms. So you said IFMSA, it's International Federation of Medical Students Association. So that's how I met Danielle when we were very active in the federation. You were president of the Colombian medical students. I was the president of the Philippine medical students. So those kinds of global experiences expose us to global realities. And now it's really exciting to see Danielle doing his share, giving a share in addressing sexual and reproductive health. So welcome to the Philippines. And then next, Jean.
Hi, folks. My name is Jean. I'm the executive coordinator of YC, so our youth coalition, I should say. So I am the staff at the YC are facilitating the work of the membership, we have 24 members from across the world who are working on a variety of issues. So our job as staff members are to support them. I'm from Canada. Before I joined the YC, I did sexual health work in classrooms in rural parts of Canada, and I also worked in the gender justice movement there. And thank you for the opportunity. It's so great to be here. It's really exciting to see you all.
Thank you. Next.
Hey everyone, my name is Ankit. I'm from India. I'm a member of the coalition and I also serve on the board and the secretary to the board, and I maintain the reporting mostly of the organization, and I also support the LGBT work that the organization does and work around abortion rights.
And then, thank you. And then,
hello, I'm from Nepal, just neighbor to Ankit's India. My name is Babu Ram Pant, and I am, what am I? I'm the vice chair of the board of director, and I also work mostly engaged with youth coalition and international UN-related advocacy process. So we work closely with the UN system to advocate for youth-friendly and youth-responsive policies at international level. And in Nepal, I work as a human rights activist on a range of youth issues, including youth participation, sustainable development, and also youth sexual and reproductive rights.
Excellent. So that's the Youth Coalition, and I believe you have more members from across the world. Just to give you an idea of the profile of our audience that we have tonight, we have members, because this event will not be possible without the partnership with 4 organizations. The first one is, we call it BIGKIS-UPM. It's a political party in the University of the Philippines. Can you please wave your hands if you're a member? Welcome. Okay. And I'm a member too. I used to be, well, I'll always be. The second one is, it's an organization also here in the University of the Philippines. It has a long name. Can you help me? Health Sciences and Pre-Medical Students, Pre-Medicine Society. So,
Do you have an acronym?
HSPM.
We love acronyms.
So, can you please wave your hand? Okay. HSPM members. Awesome. The third one, and this is a very pioneering organization in the UP. It's Once True Nature. It is a group of members, of students who are advocating for LGBT rights in the university and in the country. So can you please show yourself to our group? Awesome. And then the final group, this is not just medical students. We come from different health professions. We have the Alliance of Young Nursing Leaders and Advocates, or ANYLA. They're not based in the university, but they are a national organization, so we have members from this side. Baker, can you say hi to them? Okay. So, yeah. And then, of course, we have guests from other organizations, institutions, the College of Public Health. We have folks from the Caloocan City Health Office. So it's great. Caloocan is like an hour away from here. And they came across this event through Facebook, the power of 21st century technology. So now let's proceed with the conversation. And I just have a few questions to the group, and then we want the whole room to be involved in this dialogue. So, just to start, just to stimulate, my first question is, what brought you to the sexual and reproductive health rights work You can share about your experience in your country, more about your background. You've introduced yourselves already, but we want to learn about your personal stories and why you feel deeply passionate about these folks. So you started already a while ago. Let's come from the other end.
Okay. Basically, I used to work as a human rights advocate focusing on youth, so that's what I said earlier. So when, if you know, some of you might know, Nepal was in conflict around 10 years ago, before 10 to 12 years ago. So at that time, the human rights situation in general was very bad. So a group of young people, we got together and we thought that we should raise the voices of young people to protect their human rights, because we're not allowed to even, news was banned in the country, and there was very, like, youth were being, I would say, arrested for just having a political opinion. So it was very bad. So we worked as a group to advocate for youth human rights in general. So that's how we got together. And when we started to converse with, talk with other young people, we started to learn about the issues. What is the issues of other young people? So generally, human rights issue is seen as a issue when somebody is shot or somebody is arrested. People think that that's a human rights violation. But when we talk to young people, we found that not having the information when you require, for example, like there are a lot of teenage pregnancy in the country, and why that was happening was because young people didn't have the access to information. So that affected their health, that affected their career, and they're not able to have good employment because of that. What we thought that, okay, not having any information, because it's a state responsibility to provide access to information to everybody, so not having any information is a services. Like, for example, if there are like a lot of people in my country especially, they were facing problems because they couldn't afford. For example, like young people couldn't afford abortion services or contraceptive services. Even like during delivery, delivering child, lot of, like, if you see globally, for young people from 15 to 19 years age, uh, the maternal mortality rate. Maternal mortality is like one of the highest causes of death for young people aged 15 to 19 globally, and it's more even in the developing countries like ours, which is because they don't have infrastructures, they don't have money to, they can't afford the hospital services because they have to work, and their families can't support that. So if dying because of a bullet, somebody shot a bullet, or is a human rights violation, then dying not being able to afford the most basic of health services, it's also a human rights violation. So states should make sure that people can afford and they have the services when they require. So we thought that these are all the human rights violations, and we should, because nobody else was talking about the issue. So if you think about sexual and reproductive rights, or even sexuality in general, it's a very contented topic. I remember when I used to do my high school, there used to be a lesson on reproductive health, reproductive life cycle of frogs. So our teacher used to be very shy to talk about it, and so were the students, And I remember instead, like, they were in a program, I want to share a story. Like, in a program, they were mostly adults, right? So somebody asked them, how many of you have had sex? And nobody answered that. And then the person asked another question, how many of you have children? So everybody like raised their hand. So I don't know like how they have their children, but basically what I'm trying to say is like sexuality is a very taboo subject in our society, and it impacts in a way that people can come up with solution to their problem. For example, like for adolescent, teenage pregnancy, sexuality, even menstruation in a lot of cases is a taboo subject, and they can't ask questions to their teachers, they can't ask questions to their parents about relationship in life. So that we lead them to other risk factors such as HIV, early pregnancy, and other miracles. So that's how it started working on this issue of young people.
So like there's was an awakening, that you saw these problems, they exist, and aren't they very familiar, to our own circumstance. So now let's ask Ankit, what brought you very briefly to the sexual and reproductive health rights and goals?
Okay, so I studied physics at the university. So I was in sciences for my undergrad, and it was just generally very disturbing how sexist and homophobic the department in general was. So even though there were really few women, but there were often comments that were easily passed by professors in the university, but also like homophobic comments. So one of my initial work was starting a community-funded queer youth club called Queer Campus of young queer people who could meet and talk about their life, which completes 5 years now. And then I started working with a lot of NGOs, and I sort of realized how much of a big gap exists in India right now for young people to even get information on sexuality, sexual health, the access to contraceptives is almost negligible, even though you could just go buy in a pharmacy. Yet how stigmatized it makes it almost impossible. And that's sort of something that brought me to SRHR and working towards sexual rights in India.
Thank you.
Yeah. So I started out doing sexual health work on a grassroots level at with local organizations, and I think part of what brought me to that was just my experience with sexual health education where I'm from. There was very little of it, and that informed the sexual experiences of my friends and myself. I think young people who lack sexual health education end up with a lot of either dealing with health issues, reproductive health issues, or having bad sex. So I think we don't often talk about within sexual health education, and that was a big part of it for me and my experience. I think I then started to teach sexual health education and do sort of grassroots education in my own communities, and I think my interest in the subject, whether it's sort of violence against women or women and trans people, I should say, or abortion issues, from some of the experiences and seeing the experiences of my friends and family members who have had a rough go through medical systems. For example, there's high rates of violence against gay and trans people in Canadian medical centers, which is sort of a surprising fact that we don't often talk about. And seeing the experiences with my friends trying to access abortion in certain provinces in Canada and that kind of stuff. So I think it was that level of I think for a lot of us it's personal, right? I think, and that's sort of why we're so passionate about it, I think, a lot of times.
Great. Danielle?
So, I was a medical student, and I got involved in a medical student association, a scientific medical student association. So we look at things from a very kind of quantitative and more physical way. That's how we see how. So in the International Federation of Medical Student Associations, I started attending some international workshops at the World Health Organization. And one time I met someone who said he was a part of a group, and they were doing a series of youth policy reviews all over the world, and they were doing one in Colombia. So I got in there, and while I was doing that research on how policies affect the lives of young people, especially in their health, I saw that, for example, the second cause of death for adolescents worldwide is HIV. And HIV incidence is decreasing for all age groups except for adolescents, especially young men who have sex with men and other young people populations like transgender people, sex workers, people who inject drugs, and people who are in prison. So I started working a lot with sexual and reproductive health, but when I was coming to an end in medical school, I realized that you cannot address these issues from only a medical perspective, but you need to do that from a rights perspective. And that's how I got involved with the YC, or the Youth Coalition for Sexual and Reproductive Rights, because that's a broader approach, and it was a space for me to learn also and to give my knowledge. That's how I got involved.
Thank you, Danielle. And lastly,
Yes, so my sort of journey started in, I think, 2006 when I started my studies. Before that, I had no clue about sexual and reproductive rights. I had no sexual education at school, so I was one of those young people who had no clue about sexuality, basically. And when I got into my university, I started studying political sciences. I was really into human rights. And then I actually realized how conservative Poland is in terms of talking about sexuality and in terms of introducing this topic to young people. I saw a lot of gender inequality in Poland, which is, as you might know, very conservative and Catholic country, and there's a lot of bad influence from the church that is coming to the secular sphere. And then I thought that if the clinic is the world, and that was also my feeling, then by studying political sciences, I'm equipped with the tools to influence policies, or I will be when I finish. So, coming from the grassroots level, I started as a sexual health educator at major music events, and I found it really interesting that young people claim to know how to use contraception, but they're afraid to talk about it. So when you ask them, okay, so show me how to wear a condom, they were, okay, no, I'll start it. So I thought that it would be worthwhile to start working on it and changing this country a little bit. And then from the local level, I went to regional level, and I saw that with my skills, shaping policies, influencing policies, I would be most effective when I work at international level. So that's how I got involved with YCSRR, which is the Youth Coalition for Sexual and Reproductive Rights. So I thought that this is the most efficient way for me to treat the patient with the society.
Great. So basically what I got is, and I asked you about your personal stories, but your stories are deeply intertwined with the issues that you are now trying to grapple with. And it's a wide array of issues under the sexual and reproductive health rights umbrella, not just access to contraceptives, but also violence against women and abortion, unsafe abortion, and so on and so forth. I understand you're here in Manila because you are machinating something for world domination. They have a meeting in Bayview Hotel, the board of Youth Coalition. But in concrete terms, what are you doing, as a coalition, but also as personal advocates in your respective countries, so that we can give some ideas to the young people on how to launch their personal advocacy for sexual and reproductive rights? Anyone can start.
We want to divide that by local and national? Or?
I think that's a good way.
Okay. Sure. I'll start in terms of local context. So, I've been working on the ground for a couple of years now, and we were forming small local organizations. And I actually work at a university-led organization, which is really great. And I think universities are like this really amazing opportunity for radical change, and you guys are really powerful as students, I think, in a lot of ways, and have the ability to organize in ways that other people don't necessarily have. So I would encourage you to take advantage of the communities you have in this room and at the university. We've done also, my activism on a local level was based in education, but framing education that was youth-led, right? So, and it involved young people to have that sexual education they wanted. So, for example, my sexual health education was also done in schools and was largely influenced by the church, and was sort of adults giving information that was incomplete and actually just false to young people. And so we sort of took that into our own hands to be able to sort of produce information that was accurate and that also reflected young people's needs and their actual lives. So a good example, I think, that of something we did recently was talk about, sexting, taking photos and sending it to your partners. That's been a big thing in Canada recently, and it's all so often fear-based, right? So it's all about if you do this, it's all bad things are going to happen. And I'm sure you've seen this around contraception and around just having sex. It's if you don't have sex, you will die. It's the worst thing ever. Or you'll definitely get STIs and you're definitely going to get pregnant. And that's not the reality. And people are practicing safe sex if they have the correct information. And so it was about telling young people from a harm reduction standpoint, right? So acknowledging that these things happen, people are going to be having sex no matter what you say, and giving them the information they need to therefore protect themselves and empower themselves, I think was really useful. And involving young people in that process, I think, is sort of the base of what we were doing on a local level. I think their own lives. Like, and we all often talk about this. It's not just a chauvinistic thing. You aren't just thinking like, oh yeah, here's the young people. They'll say something, and then we're gonna ignore them. It's like young people have a right to have a say in decisions that affect their lives, and that has to do with like laws and policies and all that kind of stuff. So it's not just enough to sort of be involved in a meaningless way. We have the right to be the decision maker.
Anyone who has anything to add? The UN?
Yeah, I want to kind of bridge that thing, local and international thing. So yeah, I think what Gene said hit the nail, and it's that you have the opportunity, you're in the right space to create those coalitions, those partnerships, those networks, like Renzo is doing with Reimagine Global Health. Like creating this network of people within the community, it has a lot of impact. So when I started as a medical student, like my local medical student association, then I got involved in the National Medical Student Association. So what we were saying, okay, we have these health programs. What can we do? We need to do research. We need to like create the evidence base. We also have a say in the education we get as medical students or as health students, because often these are the like senior doctors who say, okay, you need to learn this and that, and they have no rights-based approach, or they treat patients as a number, like bed number 1, bed number 2, bed number 3, or with their national identity numbers, and that's that's something we wanted to address and change, because as Gene said, as young people we have the right to be present, to participate in decision making, and to have youth-led driven initiatives. So in that sense, these student and youth organizations and associations are the best way to share experiences and to kind of have a better impact. So with the International Federation of Medical Student Associations, we saw this opportunity of taking what we were developing at the country level, take it to the international level. So we started attending the regional, like Pan-American, myself, the Pan-American Health Organization or the World Health Organization, talking about comprehensive sexuality education, talking about adolescent health, talking about HIV, talking about all these things that usually don't have a youth voice, or they're not interested sometimes in hearing about it.
Despite youth being disproportionately affected.
Exactly.
Which you guys all know, right? It's like you don't have, we're going to teach youth what's best for them, despite the fact that they're the ones that are most affected, that they probably know their lives better than these people who, are trying to impact us.
Yeah, so still, in the health arena, we're going there and we're trying to make our voices heard, but still, like they invite us to this panel, but they're not inviting us to take part of the decision-making process, right? And that's the issue, and that's what we're trying to change at a national level and at the international level.
So what you're saying is we are not yet there in the decision-making table.
Yeah, we're not.
But of course, young people are adamant, and we cannot surrender. So that's why we need organizations like the Youth Coalition. You want to talk about a bit of the table, the decision-making table, the UN.
There's a saying in Africa, we say that you have to bring the person whose head is being severed to save the head, Or like in Nepal, we say that you can't have a marriage without the person who is going to be married, So it's like same in the advocacy process. Like you can't have adults talking about issues of young people. Okay, we are gonna give them this, we're gonna give them this, without having youth at the table, because they know how their lives is, they know how their relationships are, and they know what is going to be helpful for them. So how in the UN we work is like we try to work with the UN system to make, like many of you probably know about Millennium Development Goals, which were the big development goals. So they're like development goals and the UN human rights treaties that UN has, and it impacts the work of different countries. So what we try to do is influence the work of the UN so that they try to address, one is they engage young people and help us put our views and opinions in the process, and also make sure that those policies are respecting and the human rights of young people. So if you see my work at national level, what we try to do is like, my country actually has signed every human rights treaty mostly that's under the planet, So they say that okay, we'll sign it, and you bring any event activity, they just sign it, and they say, okay, the job is done. So what we try to do at national level, like these people in youth coalition, they make sure that the documents at international level are progressive. So when my government signs it, what I try to do at national level is like hold those governments accountable. Like, okay, you signed it, but the job is not done. Because you have signed it at the international level means that the policies and laws at national level also must be protecting the rights of young people and promoting gender equality. So we try to make those laws more progressive and more human rights based for you. And after we do that, and still the job is not done. We make sure that the government implements those policies, because our government has like one of the best laws in the whole South Asian, but this is still not sufficient. So we advocate with the government to make sure, okay, you signed this policy, you made this policy, but it's not yet implemented. People are not getting access to services they want. People are not getting education and or information. So we talk with the government, the ministries, or prime minister, whoever it is. We do advocacy campaigns to make sure that government are pressure enough and provide the rights and provide the services that are in the policies to the people.
I think you can, when we talk about what YC does, you can, I think, see that all of us come from different expertise levels in terms of like building capacity with young people to advocate on behalf of themselves and producing information and for young people to use. And what else do we do? Capacity build.
You're already doing a lot.
Stuff like that. So it's like along a couple different tactics.
And we challenge them. Like we challenge countries and stakeholders, because the reason behind us not being at the decision-making spaces is because we're seen also like as risk or as trouble, young people. So if you're young, then you're gonna get STIs, or you're gonna get killed, or you're gonna do drugs, or you're gonna get pregnant. That's what we do. When we don't study, we don't work, we're not artistic, innovative.
We're not making Facebook, we're not making Twitter.
Exactly.
They are not young people.
Exactly.
Also, like how Babu talked about how international work feeds into the international work. I think one of the good thing about YC is most of us, all of us are activists in our countries. So and that also feeds into our work with YC. And we understand challenges of young people in accessing sexual rights and reproductive rights in our countries. That also feed into our work with YC.
And one also what we do in addition to advocacy at the real level is also we are limited people, right? We're 24. Though we try to change the world, in reality we can't change the world ourselves, right? So we need other young people to work at continental. So what we also try to do as YC is build the capacity of other young advocates in different regions around the world. So we work in Asia Pacific, we work with people in Middle East, North Africa, in Africa, Latin America, Caribbean, so we try to build the capacities of youth advocates from around the region so that they can go to their countries and advocate themselves. So we are not the one trying to advocate for everything, but we also build capacities so it is sustainable, so that they can work with their countries and advocate with the government for the right to them.
For example, we developed abortion advocacy guide for young advocates to know how to advocate for abortion rights and safe abortion. We've also released a series of policy briefs linking post-2015 young people and poverty and climate change and all of these things. So we're trying to create resources so that young people.
And these are downloadable, right?
Yeah, they're free.
Please visit their website so you can access all these valuable information. So yes, in a way, we've seen the work of the Youth Coalition. I've heard the phrase capacity building a lot of times, and I hope this kind of dialogue that we're having, that does not only build capacity, but also sow inspiration among the young people in this room to start their own advocacies. And we've heard a wide range of advocacy strategies, from education to local action, networking, network building, like spreading the virus, of course not the papilloma, but also engaging with decision makers, policy makers, speaking truth to power, and that's what they're doing now. And I'm sure you've been trying your very best to avoid this, what we call tokenism, just to have a youth representative in a conference does not mean that the outcomes of that conference or that discussion will really make a huge impact on the lives of young people. So at this juncture, I will stop, prohibit myself from asking because I want you to really interact with our panel before I continue asking them with a barrage of questions. So anyone who would like to start the ball rolling, state your name, your affiliation, and briefly your question or even a comment or an insight. Come on, Filipinos are not shy people, right? So, yes.
Hi, good evening. I'm John from Once True Nature. I'm one of the founding members. So, one of our very interests in our organization is definitely research, education transformation, and creating networks. So, I'm just interested in your experience. How were you able to do this? Because in our organization, that was one of our main struggles. How we will implement these strategies.
And maybe can you give a concrete example of a barrier that you've encountered so that they can directly respond?
So for example, in terms of our research, we are thinking how the research will be done, what will be the sample population, what will be the impact, will it be within the university or outside the country or within the country. So we're just interested in your experience, how were you able to navigate these barriers?
Yeah. So I think in research, especially, you need to go step by step. So if you're in the university and you don't have that much of experience or funds and resources, to start small. Try to first have a clear objective of what you want to inquire about. Yeah. And why do you need that information? Because you need research to solve problems. It's not research for the sake of research or for the sake of publications, which we see a lot, publishing papers or books. So why do you need that information for? And take advantage of research groups at universities. So make partnerships with other faculties, with other students, and with your professors. Because sometimes the universities have halls and they have funding available for that. So try to arrange some workshops or meetings to develop your capacities on research methodology, and also try to talk to other experts on how to use that research, not only for publication, but to spread that information so that it changes the status quo and the situation that we're in. I hope that answers a little bit your question. Yes.
Yeah, maybe in the future, your two organizations will organize a workshop, Philippines can host it on research tools for sexual and reproductive health, issues.
I come from a medical student scientific organization. So if you're interested in research, there's a lot of people interested in research, and you can
And just to comment, because you mentioned about networking as well.
Okay.
So our example of networking is being here. This is one of the ways you do networking. So as a small organization, I think you should take every opportunity of speak anywhere you can. Present your ideas, speak to as many people as you can, and it's really amazing how people actually are connected in the world. You'll see that a friend of a friend knows an organization that works on the same subject. You'll be able to connect. And actually, so one of our ways of effective networking as well is accepting members who have already networked within the regions, so that you can build these connections internationally, but also at regional levels.
And that applies on the local level as well, right? Folks have a huge amount of experience and energy to give to a movement. I have no doubt, right? So I'm sure there's folks in this room that can build those partnerships with your own networks that you have in the city, whether they're medical related networks or activists or whatever. Use your university. Universities. I worked at a university for 3 years.
get caught up on the lack of resources. There's a lot you can do with your own time. If you're passionate about it and if you're interested, that's all you need to start. And once you get more experience and once you get those networks, the funds and more opportunities will come. So don't get caught up on that.
Just as an example of how powerful networking is, later I'll be adding 4 new people in Facebook. So that's how powerful connections are, not just for the sake of gaining new friends, but really accelerating the action, expanding the movement, spreading world-changing ideas. So, next.
Sorry, I'll jump in with one. That just made me think of something. I work a lot with the sex worker rights movement in Canada, and that is like a global movement of people. So it actually, literally, if you want to connect with us about our experiences in country or internationally, there's ways that we can build off of each other's movements, right? So we're no longer in silos, which is pretty great in that way. So that's just nice, right?
Excellent point. Next question, name, affiliation.
Good evening, I am Jonathan Morris from Alliance of Young Nurse Leaders and Advocates. We are also affiliated with Youth Consortium, YC also, for reproductive health here in the Philippines, which is a group of different youth organizations advocating for SRHR. I don't know if you are familiar with YPER, they are one of the members, YPER Philippines. So basically our group started by UNFPA, and this is for the passage of reproductive health bill, ensuring that ESRH provisions are included. However, in the passage of the law in 2013, we think or we believe that the young people were left behind because of the specific provisions that became a barrier in the provision of services for young people. It states that you need a parental consent to get a commodity or a family planning commodity. And of course, if you are a young one and you don't want your parents to know that you are sexually active, you will not bring your parents to the health center to get a condom. So that became a huge barrier in the country. And we are trying and thinking on how we can circumvent this policy to lessen the effect in the Philippines, particularly the teenage pregnancy in the Philippines is increasing, and also the cases of HIV and AIDS. So being an advocate in the international level or in your own respective countries, how you came across also these kind of issues and how did you deal with it?
Okay.
Yeah, I think that's a common problem or challenge in every country. So when we try to deal with, we think of, when we think like parents not wanting to give education to their children on sexuality, like we think whether they could rewind the videotapes, of their lives and see how they were when they were adolescents, whether they didn't want to get information or whether they were curious about information. And I'm sure like most of the parents wanted to get information about sex and sexuality when they are adolescents. So mostly parents don't want the kids to know about sexuality because they think that sexuality information or any information promotes sex, so that people are jumping around the streets and having sex once they get the education, which is not the case because research has proved that sexuality education, which is comprehensive and human rights based, that actually delays sexual debut, among adolescents, and that helps them promote sex and healthier lives. So mostly, even if parents are not giving sexuality education, everybody knows that nowadays people have access to Facebook, YouTube, Twitter, everything, and they are going to look for information anyway. So what they really need is the correct and factual and scientific and human rights based education so that they can use themselves. So what we found useful in our work is informing parents. One is empowering adolescents, because I have also worked on issues like child marriage, where empowering young people should be one of the main components, so that young people could speak themselves with their parents or teachers about why information they need or why services they need are helpful, and also like working with parents and teachers unions at community level, so that they also understand that providing information or services is not something risky for their children, so that they would support those kind of initiatives. So we feel that it's important to work both with adolescent and young people as well as with teachers, parents, or sometimes with religious leaders that we have done some work in our country.
We have our safe abortion advocacy guide, which is available on our website. It's related to abortion, but it has a whole section on parental consent and ways of advocating around that. So that may be useful. The PAC also has a fact sheet about parental consent.
Yeah, not only a sheet, but the PAC is a collaboration of youth-led. You know the PAC? It's a collaboration of youth-led and youth-serving organizations in the AIDS movement, right? And we're part of the PAC. We do not only have that fact sheet, but we conducted a global survey on parental consent, which aims to develop that evidence base so that young activists can really demand their health services and their, the government or their authorities so they can address these issues. And what I was going to say, another way, is to kind of pair or team up with other civil society organizations, not only in medical field, because we sometimes get we live in a bubble. So go to human rights activists and to civil or feminists and other groups, because if you have the information, if you know what Babu said, that the research has shown, if you show numbers, if you show how these barriers really affect the health of adolescents and young people, and if you team up and demand that, and demand your participation in the establishment of those policies and those services, then you're going to be able to really influence how the service is delivered.
Well, here in the Philippines, I remember there was an anecdote when a senator was told that there are 11 mothers dying every day. The senator, in ridicule, responded, "Can you show to me the 11, mothers, death certificate?" So that's how, numbers are being, distorted, in this kind of, very peculiar context. But I'm interested, and since Nathan already mentioned about the reproductive health law that was passed only in 2012, after a 16-year battle in Congress, in Congress. I'm curious about Colombia's experience as a Catholic country, just like the Philippines, and how the reproductive health, sexual and reproductive health movement in Colombia are, interfacing, working against, all these kinds of religion-driven, influences in this area.
It's been really hard.
Okay.
It's an ongoing fight. So there's a very, very good research on youth policies and sexuality that I use for my own research. And it kind of illustrates how these different movements got together, not only the youth movement, but the feminist movement and the sex workers and Catholic for Choice and different movements around society. They were teaming up together, trying to demanding the government to do some things. And so according to they were using, like Babu said, they were using these commitments that the country acquired at the international level, like the ICPD program of action, like the commission on I always forget, CEDAW, the commission on the elimination of violence against women. I always forget the acronym. So we were using all these instruments, all these tools, to demand the government to fulfill their duties, right? So, for example, in 1994, we had this governmental mandate to create sexuality education, and we had this vice ministry of youth, and they were in charge of sexuality education, but they were highly influenced by the Catholic Church. So we kind of sued the program. Legally, we pursued legal action because they were not promoting rights, and they were being very like negligent, and they were very biased. So it's been an ongoing fight right now. We were like a couple of weeks ago, we were in a national discussion on same-sex adoption, and we've been on that discussion on same-sex marriage. It's not been great, the outcomes, but we have reached some results. We don't have those legal consent, parental consent barriers. We now have like free access, supposedly, to healthcare services and sexual and reproductive healthcare services for young people. But still, it is present at the policy level, but that's not being adequately implemented. So that's like still an ongoing fight because the church does not only have influence at the national level, but they own schools, they own hospitals.
Very similar.
So, it's very similar. So trying to take away those prejudice and prejudgment. Try to use evidence a lot because that's not what they see. And if you bring evidence, if you bring numbers, if you bring results, indicators, that's a very good tool. But it's an ongoing fight.
Evidence and the human rights principles.
And mobilizing society.
Mobilizing, yes. In Latin America, is it only Argentina where same-sex marriage is legalized, or are there other Catholic?
Uruguay,
Brazil.
Yeah.
So Colombia is not yet there.
We have that like registered partnership, like a civil union
Not
thing,
really.
but not marriage.
Not marriage.
Not marriage.
Okay. So I'm not sure the Philippines is ready for that. Okay. Maybe we have some insights from the audience, but we still have time for more questions and comments and insights. So
can I say something about being ready?
Being ready?
Yeah.
Okay.
Is that because when you say that, for example, they were saying a couple of weeks ago that Colombia was not ready for same-sex adoption. When are they going to be ready? Like they're never going to be ready. So you need to. People have the right. So if you talk about like the majority, you're kind of the power dynamics. You're not acknowledging the minorities and their rights. And they are the ones who have been oppressed for a long time. So it's not about being ready. It's about implementing ways and tools for them to be ready and for them to respect human rights. This is something about human rights. It's not about being ready or being culturally sensitive. And we need to advance and make progress in that because it's about human rights.
And going back to the principle of inalienability of human rights, you were already born with the right, so it's not a question of readiness. So I really like that point. Anyone who has a burning question, let's bring more fire to this discussion. Okay. So, or else I will be asking another question to the panel because a while ago Babu mentioned about the Millennium Development Goals, and we know it's expiring this year, 2015. I know you know that, students. And it will be replaced by a new development regime, the Sustainable Development Goals. Some call it the Full 2015 Development Agenda. So I'm particularly interested, how is sexual and reproductive health positioned in this new development agenda that we are about to see that will be unfolded in a few months' time in September in New York? And are you happy with the situation? If not, how should we move forward?
Right.
So this whole process of shaping the new development agenda has been going on for years, and we as Youth Coalition, we've been focusing on it for the last years. So it's been our major part of work. And so the goals will be formed and agreed upon, as you said, later this year. But they're not, nothing is over yet. The goals are sort of formed. there are, as far as I remember,
17 goals.
new goals that are proposed by the Secretary General of the United Nations. But what is important for us is that under each goal you have smaller objectives and indicators on how you will measure if you have reached the goal. So what we are now trying to do is we're trying to still influence the decision makers to set up very good and precise indicators that would take into consideration issues that we fight for. So we're still working on this agenda. What I can tell you from what can be seen now is that environmental issues are taking a really big space in the sustainable development agenda. So we will probably see a little bit of a shift towards sustainability and towards interconnectedness between all the development issues, because there is no single issue that is isolated from the other. So sexuality of young people is pretty much connected to climate change, for example, or poverty, or gender equality. So they are all connected.
Just connected to Cuba, I did a research actually on climate change and sexual and reproductive health in 3 countries a couple of years ago, and Philippines was also one of the countries where I did my research on this one, and I talked to a lot of civil society organizations in the Philippines, like the FPO, the Family Planning Organization of the Philippines, and people working on the environment movement in the Philippines, and I found that typhoon is, I think, is one of the major issues of Philippines.
20 typhoons a year.
Environment, exactly. And I was reported that the frequency of typhoon has increased in the last decade, and how typhoon has affected is because it affects mostly many environmental disasters affect the most vulnerable and poor or those who are disadvantaged. And from my research, what I gathered was that as a result of typhoon, there was scarcity in maternal health supplies for women, so more pregnant women and women were on delivery, they were not having the services, and there were the cases of sexual harassment and rape because girls were not empowered enough, they didn't have information, and also like the environment during the disaster was so that girls were being raped or being sexually harassed, and so this is how in a sense like climate change or sustainable development impacts the lives of young people, including sexual and reproductive health. So that's the reason how we always try to link the issues when we work, how poverty affects people, how power dynamics within the relationship between male and female gender equality affects health, and how environment is closely related to health.
Just to give him a context on the situation, for example, the Typhoon Haiyan that struck the country in 2013, I remember there was like 500,000 babies that were delivered without a functional health system in that area. So it just, climate change and extreme weather events just disrupts the fabric of health systems, which result in limited access to maternal, reproductive, and sexual health care.
Follow up with that and to answer also your question.
Yes.
Well, the SDGs do mention, and this Secretary General synthesis report on the post-2015 development agenda says that young people are the torch bearers of development. But then we're very briefly mentioned in the report. Very, very briefly. And so we passed, you remember that in the MDGs we had several goals that were directly related to health. Now we have one goal, which is number 3. And the WHO, the World Health Organization, is aiming for universal health coverage, but then some of the indicators that they are proposing are not universal. So they're like 80%, and they're not very, very, how do you say? Ambitious. Specifically in SRHR, in Sexual and Reproductive Health and Rights, we have a mention of sexual and reproductive health and reproductive rights, which means they're not acknowledging sexual rights, right? So we need to take that into consideration, because sexual rights are not being appropriately addressed in the post-2050 development agenda.
What do you mean by sexual rights?
Yeah.
What is that?
Yeah, maybe you should define it for our audience.
Yeah.
It's like all these words that like in this process are sort of coded, but
So sexual and reproductive rights are like a broad set of rights that refer to sexuality and reproductive life. But sexual rights, amongst others, are the right to have your own gender identity and to express your gender identity without discrimination or harm or any mistreatment, to have or to define or self-determine your sexuality and your sexual orientation, and to be able to express it free from discrimination again, to get the
Well, one important right is just the right to pleasure, right? Like sex should be a pleasurable thing. It's not a
but it's like who's being left behind, right? So we know that LGBTQ people are being left behind when we don't talk about sexual rights, and like Kuba is saying, like you have the right to a healthy, safe, well, and pleasurable sexual life, sexual experience, and that gets left out so often. And I think, especially when we talk about women and trans people, that is like that the right to pleasure and the right to a sex life that is self-defined and fulfilling and based on more than just reproduction is consent, right? Like it's not always there, and it's absolutely pivotal that we frame that in that way, and being left behind in those spaces are already the most disproportionately disadvantaged people. That's important.
And also sexual rights also include one of the very most important decisions in life, like when you are going to marry, whether or not you want to marry, with whom you are going to marry, whether after marry, whether or not you want to have sex,
Yeah.
So these all decisions in life are also part of sexual rights. So that's what the government is doing.
So I was doing, for my research, I was looking at this national survey in Colombia, and actually more than 50% of women don't know that they can refuse sex when several conditions, like their partner is cheating on them, I don't know the technical word, or their partner has an STI, or just if they don't want to. They don't know that they can refuse sex. And that's problematic, very problematic. And if those sexual rights are not included in the post-2050 development agenda, then we have less resources to use to demand our rights.
I think we talk about this stuff, and we're folks who are working predominantly at sort of the policy level. But when we talk about sexual rights, it's not only like things that you can write down in laws. It's a whole cultural shift, right? It's about addressing the fact that we live in a rape culture where rape is permissible a lot of the time. It's about creating a culture where consent is part of every sexual exchange or relationship. It's about sort of breaking down patriarchal systems. It's about addressing sexism. It's about addressing transphobia on a cultural level. So I think we can see when we talk about sexual rights the really clear connection between grassroots or local or the way we live our lives as individuals and communities, and the way that connects up to things like laws and policies, right? It has to be bottom up and top down. We have to connect those, right? It's not only about legal shifts, it's about the way that we think of this stuff in our communities, it's about holding each other accountable.
Great. I think these folks have talked about UN and UN, but as youth activists, we can still get involved in influencing the agenda that's going to determine our lives and determine our sexual and reproductive well-being. There's a Google group called Major Group on Children, which you can join and you can comment on it often, talk about your sexual health, what you want in the agenda. There's a UN Secretary General's 41 website where you can talk about issues that you want to prioritize in the development agenda. I guess Babu could talk about all of it. There are still ways for you as youth advocates to get involved.
And also, if at the local and national level, you work to you organize yourselves and you demand your delegations, your ministries, and even the hospitals. They have also opportunity to advocate on behalf of your
I
rights.
think, like, never to diminish the power of grassroots organizing, right? So I think that, for example, we have I don't know what it's like for you folks. In Canada, the med curriculum doesn't have any, it doesn't talk about, it has like an hour on LGBTQ communities and like a couple hours on sexual health. I imagine probably similar, not much, right? So we organize, like sexual health educators go in and talk to med students. And it was a really great dialogue, and like that has impact all the way up, right? Because you're making leaders who are more informed. I think we should also never underestimate the fact of getting in touch with your politicians, right? If that's something you're able to do, given like wherever you're from in the world, as young people, as us, contacting your politicians and getting in touch with them personally, to irritate them, call them every Friday and be like, hey, so what have you done lately about my sexual and reproductive rights? I'd really like to know. Like you have that power often, right? So that's something you're capable of doing. That's a good way of getting involved, I think, honestly.
Wow. As you've noticed, the conversation just naturally flows. You really don't need a moderator, but at this juncture, I would like to ask again our audience whether you have questions or comments before we kind of wrap up the discussion. It has been a very fruitful and meaningful exchange, and I hope our neurons are fired to the brim. Anyone? Question? Sharing? Okay, we have one.
Naomi, I'm from UCC, OPM, I guess. I really found the discussion really enlightening, and also, I do feel I have the same sentiments as you with regards to like sexual rights and all of that stuff. Like especially in the Philippines, it's really, really hard to get people to I think it's because of our culture, because we're talking about the cultural shift that we need. And it's really our culture here that is kind of limiting us towards developing our capability to achieve those sexual rights that we were talking about. Because from what you were saying, like we have to get in touch with our politicians and all of try to organize our community in such a way that we can find an outlet so that we can achieve those rights. However, I find that here in the Philippines it's actually very, very difficult to achieve that because a lot of the times sexuality really isn't on the agenda of any politician ever. It goes on to the government. It's like it's very rare that you can find someone who is trying to speak for the people when it comes to sexual rights, especially with LGBT rights. So I was wondering if there was a way we could address that. Like, is there a possibility that we could find how exactly can we try to shift the cultural way of thinking of the people so that we can be able to achieve these universal sexual rights?
I mean, that's a huge question, right? And I mean,
We need a revolution.
yeah, well, I mean, yeah, but like, I think so, a revolution starts from home, right? So, I mean, I think that like, we could all talk about different tactics, and we all work at different levels, right? And so, I would suggest.
And we face those problems in every country.
Yeah, and I would just suggest, I'll suggest from the very bottom, the first brick, I think, is like talking to people about this. Like, inform yourself, and then be a day-to-day advocate about sexuality and sexual orientation. And I drive people nuts at parties because I just won't shut up. Like they're just like, okay, like it's getting boring now. And like really, I think in your day-to-day life, if you can be a constant advocate, you will change the people around you, who will then change the people around them, right? So that I think is like the fundamental basis of activism in my view. Now I think everyone here can give bigger picture ways of changing that, but I think like it can feel overwhelming if you're within a system that's oppressive, and I think all like Canada has a oppressive system, Colombia has a oppressive, like there's all sorts of different contexts. And I think it can feel overwhelming, and when it's overwhelming, you can control the way that you are interacting with people around you. You can cause change in your community.
I personally really see huge benefits in public demonstration and public organizing. Just being out there, getting people to know we exist, we're still here, we're still fighting for our rights, and that sort of shake them up really well. At least in India, it works really well. Because just like organize a public demonstration, public protest to let them know that they are fighting for rights. Something we are very often doing in India is invite people from other movements and attend their movements, because as Tobon Garcia said, our movements are interlinked. We're still working. We have to work with each other. I think that's a great tactic that works for us very often. Organizing public protests, I still have given my take in that.
Yeah, I think most of what you said about, and also like often in our work, people often say, as you rightly said, I think this is not the right time. We have to wait. So what would happen? Like if you imagine slavery at the time was the right thing, right? But it was. We now know everybody knows that it's wrong. 100 years ago, women were not allowed to vote. That was never the right thing. But at that time, people thought that, okay, maybe this is the right thing at that time. So, some things are wrong always, It's never the right time to wait for right time. It's not okay to lose your life just to give birth to a child, It's not okay that young people get AIDS and risk their lives because they don't have information. It's not okay that women are being raped, and it's not okay that women are being violated and discriminated and they don't have the equal rights as men, right? We don't have to wait for 50 years. That we know. If you talk to politicians, what they always say is like, okay, what impact is going to have in the GDP of the country, or what's relation to the economic development. But we, I think, should have that conscience, or should know that things might take a little bit of time, but it's never a wrong time to advocate for the right thing. So just keep pushing, and change will start to come. Yeah.
So yeah, building from that and taking a step back. I want to pick up what Jean said and what Ankit said. And sometimes when I was a student, I found it very kind of complicated when we talk about movements. I didn't know what that meant. And like I was saying, just if you're part of an organization, like a local organization, get in touch with other like similar student organizations and just talk to each other. Like Jean, I wouldn't shut up in my medical student meetings, and I don't shut up at my work when they give like homophobic comments, or when they talk bad about women, or when they do this kind of thing. Like I don't shut up. And if you start educating people and you start building these like connections and networks, you all can have like a very big impact. Don't worry too much about the politician yet. You know that when they're making policies or when they're consulting to like formulate a policy, they usually consult the academia and the civil society. So start making those connections. And if you have the evidence, you're at a university, probably one of your professors are being called or is being called to consult on a youth policy or sexual health policy or health policy or the health system policy. So start like influencing at those levels, and it will reach the next level.
Just a little comment, because I think that all our comments, I'll try to pack them in like one little box. Because this is from I graduated from political science, but this is from psychology. So most of the people like to be somewhere in the middle. They don't feel in their comfort zones when they're near the extreme zones. So what is the role of an activist to me is to push those boundaries. We are the ones who say, no, human rights don't end here. They're still there. So when we push those boundaries, people feel more comfortable to associate with the ideas because they see that other people are already, a few steps ahead.
The norm shifts.
Exactly, and then the middle shifts towards, full realization of human rights. And this is our crucial role because when I look at my Polish example, I remember that like 10 years ago there was no mention of LGBTQ people and their needs. Well, now in Warsaw, this is one of the hot topics. It's even hip to talk about it, and this is actually what we want to achieve because we want people to talk, to discuss this stuff. We want people to to be the advocates. And if we push those boundaries, other people will feel more comfortable.
You were saying that it's very, very difficult in the Philippines, but I'm saying you're not alone. It's very, very difficult in Colombia.
It's difficult in
Very
Africa,
difficult.
in
You're
Uganda,
not alone.
in Uganda, I think they criminalized
Yeah.
homosexuality.
Nigeria.
So there are many, and I think these are global issues, and that's why we're having this global conversation. And before I wrap up, I think, Jean, you want to invite them to.
Oh, yeah, I mean, well, I don't know how best to do this. We have a newsletter that goes out with new resources and information and stuff like that about us. If you're interested in being on that list, I don't know if
We can post the email address in the Facebook Reimagine Global Health.
Great. And so are you allowing me to give the attendance list to them so that you can also receive regular emails?
And also what we can do
We
is
don't spam.
They don't spam.
Right. And either that or we can put it up our website up and you can go sign up on our website
Cool.
and check out our resources.
Excellent. Wow, it has been a very fruitful and enlightening and also, I hope, inspiring discussion that we had tonight. What are the lessons that we can bring home? Take home messages from this session. I'm sure it's an overload of information, but also I hope an overload of inspiration. From their personal stories, how they do things, how they try to challenge the status quo to make this world a better place, not just for sexual and reproductive health rights, but for the achievement of human rights in general. They mentioned about the power of evidence and how it could be a very potent tool in effective change, as long as evidence is also married with the human rights principles of universality and non-discrimination and inalienability, and of course accountability, because human rights do not just come from somewhere. There has to be accountable institutions that we need to follow up. And also, I think their stories teach us about. I realized, he's a political scientist. I think I'm Crit. Yeah? You forgot to mention you didn't emphasize that you're working on people with disabilities, and he's a doctor and who has a sociology background. Babu. So, sexual and reproductive health rights, human rights at large, are an enterprise of the entire society, regardless of your discipline or profession. So it's not because you're a medical student, this is your issue, and you are a nurse or an anthropologist or an engineer, this is not your issue. This is our collective issue, and therefore we really need whole of society, approaches in addressing these issues. We saw the importance of looking from a really broad perspective, the social determinants of health and how they result in gross and unacceptable inequalities in terms of sexual and reproductive health. For example, cultural dimensions, exclusion, so on and so forth. And finally, I think an important take-home message is that all of us can do our share in this work, in this noble cause. In small things, in big things, we can make changes. We need to just talk, and I'm getting afraid because we're going to karaoke after this, and we might end up talking about sexual and reproductive health, which is fine. Which is fine, okay? But also, I think, and I want to close with this quote from Eleanor Roosevelt, the mother of the human rights framework, the one who led the crafting and the signing of the Universal Declaration on Human Rights. She said, "Where, after all, the universal human rights begin? Of course, not in policies and declarations, but in small places close to home, so close and so small that they cannot be seen on any maps of the world. Yet they are the world of the individual person, the neighborhood he lives in, the school or college he attends, the factory, farm, or office where he works. He works, so it's still very patriarchal, sounding. Such are the places where every man, woman, and child seeks equal justice, equal opportunity, equal dignity without discrimination. Unless these rights have meaning there, they have little meaning anywhere. So it's really in the small places, the hamlets and the towns and the barangays where we live, where human rights need to flourish. And it will never flourish. People around us will never know that they have rights to refuse sex, to rights to health care, and so on and so forth, if we, the educated and enlightened ones, do not do our share. So, thank you very much to the Youth Coalition. Thank you for allowing me to steal you from Bayview. They've had a very fruitful weekend, and we're looking forward to collaborating more with your group. And I hope to our participants here in the UP Manila that you will continue to learn, to understand the issues, and to, most importantly, do something really tangible that will affect change in our own communities and in our own societies. Let's give, of course, the Youth Coalition a big round of applause. And of course, thank you for allowing me to bully you to come here, to drop by. And of course, as I've said a while ago, this is a series of discussions. We really want to stimulate, these kinds of, discussions so that we can strategize and come up with, solutions to seemingly chronic problems of injustice and violence and an achievement of rights. And so please keep abreast of our updates in our Facebook page. You will definitely get emails as to the next session. We're concocting something, maybe not anywhere in UP Manila, in another university. We want this to be a caravan, a roadshow across the country, where we will be tackling, the pressing issues of our time. Last time we had a session on Ebola, this time on sexual and reproductive health rights. Next time, surprise, surprise. So, again, thank you and have a good night.